This podcast is brought to you by the Senior Techie, a source of information for seniors and others about technology. When you think about holidays in March, St. Patrick's Day is usually, the first thing that comes to mind.
Right, yeah, parades, wearing green, things like that.
Yeah, maybe hoping for a little luck of the Irish. But I have a bit of a surprising question for you today. How do holidays like St. Patrick's Day actually connect to taking charge of your personal health?
I mean, that is definitely an unexpected pairing. You don't usually associate shamrocks with healthcare.
No, you really don't. But today on the Senior Techie podcast, we're looking at two lesser-known themes that pop up around this time, Doctor-Patient Trust Day and Welderly Day.
Right, which might sound a bit obscure, but they are very real themes.
They are. And the mission here is to see how you, especially as an older adult listening to this, can leverage specific health technologies linked to these themes to actively support your aging. So less relying on luck and more relying on strategy.
Which makes a lot of sense, because historically, medicine has been very one-directional. You go to the doctor, they tell you what to do, and you just sort of follow along. It's a very passive experience.
Yeah, just sitting in the exam room nodding.
Right. But the Senior Techie points out a massive shift happening right now. It's really about becoming an active participant, mostly through things like patient portals and telehealth.
So instead of just waiting around for a phone call, you are, say, logging in to review your lab results online before the appointment even happens.
Yes, or messaging the provider directly.
Right, or getting that medication list perfectly prepped for a video visit.
Which kind of feels like having a private VIP hotline right to your doctor.
It really does feel that way.
It completely bypasses the stress of sitting in a crowded waiting room. But, well, let me push back a little here.
Sure, go ahead.
By asking patients to log in and interpret their own labs and, manage their lists, are we shifting too much of the healthcare burden onto the patient? Especially for those over 55 who might be managing complex chronic conditions. That is a valid concern, especially when you consider the learning curve of some of these platforms. But the real benefit to seniors is the reduction in uncertainty.
Okay, how so?
Well, think about it. Waiting days for a doctor's office to call you back with test results can be incredibly nerve-wracking.
Oh, absolutely. The waiting is the worst part.
Yeah. Having your own health records and direct asynchronous access to your care team saves hours of phone tag.
Yeah, no more waiting on hold for 20 minutes.
And the Senior Techie emphasizes that because you have the information, you actually have a voice. It reduces anxiety and builds real trust because you are functioning as a partner with your doctor.
That makes a lot of sense.
Yeah.
But getting that data from your doctor is really only half the battle. What you do at home in between those visits is where technology really steps in to manage your day-to-day vitality.
Which ties perfectly into the concept of Welderly Day, because the focus shifts from just reacting to an illness to proactively supporting healthy aging. And the sheer variety of tools available now fundamentally changes the whole geriatric care model.
We were talking about wearables, fall detection systems, remote monitoring, and even brain training apps.
Yeah, and the Senior Techie notes health-adjacent tech, too, like MD hearing.
Oh, interesting. So it proves that technology isn't just about flashy gadgets or fitness trackers for a marathon runner.
Not at all. It is about the mechanism of independence. A modern wearable doesn't just count your steps. It monitors your heart rhythm and oxygen levels, looking for anomalies 24/7.
Wow, 24/7 monitoring right on your wrist.
Yeah, and remote monitoring means a care team can catch a slight change in your vitals before it turns into a full-blown trip to the emergency room. So these aren't just monitors. They are safety nets.
They really allow older adults to live life on their own terms safely.
And it circles right back to your St. Patrick's Day hook, actually.
Yeah, how so?
Well, the Senior Techie suggests you can combine those ideas into a theme like 2 reasons to trust technology with your health this St. Patrick's Day.
Oh, I like that.
It really reframes the conversation. You aren't just crossing your fingers for a healthy year. You are actively utilizing these tools to take control.
Right. Proving that health tech can be timely and highly beneficial. So what does this all mean for you listening right now? We've explored how a VIP doctor hotline shifts the power dynamic and how wearable safety nets preserve your independence.
It's all about empowerment.
Yes, absolutely. So here is a final thought to mull over. Which single tool, whether it's logging into a patient portal to review a lab result or trying a new brain training app, could you explore today to feel more confident about your health tomorrow?
Because, taking that one proactive step definitely beats relying on a 4-leaf clover.
This podcast was brought to you by The Senior Techie. It's available on Apple Podcasts, YouTube, and Spotify. If you'd like to keep up with their newsletters, you can subscribe for free by going to subscribe.theseniortechie.com.